All right, tell me honestly, have you been there where you're in front of the mirror and you're starting to pop a pimple because you still got pimples and you happen to notice that you're getting those wrinkles outside your eyes, or maybe those smile lines are developing a little bit more than you think they should? It almost doesn't seem fair that you're now an adult and you're dealing with acne like you were a teenager and wrinkles like you were your mother. You want what we all want, and that's beautiful, clear skin. You don't want to have to be dealing with acne, and you certainly don't want to see those wrinkles catching up with you. So today we're going to talk about how to deal with those problems. Let's start with that hormonal acne. Look, hormonal acne is just no fun at all. Usually you're starting to get deep, cystic, painful type acne lesions along the jawline, over the chin, and they never want to come to a head. You try to pop them and maybe you end up leaving yourself with a scar. Or maybe you have pretty good discipline and you don't go after and try to pop them and you're covering them up with makeup and it's just not doing a good enough job. But here's the reality. Acne is normal. It's normal for teenagers and it's normal for adults, and for lots of reasons, we're starting to see more and more acne affect adults and particularly adult women. We know overall that drinking a lot of skim milk and eating high glycemic index food, that's like processed junk foods, lots of sugar that gets into your system really quickly, things that spike your insulin levels, those can precipitate acne both in teenagers and in adults. Additionally, birth control can play a role. There's certain types of birth control that can help acne, but there's certain types of birth control that could exacerbate acne. In my clinic, I see a number of people who have a progestin-only birth control, whether it's an implant in their arm or whether it's a hormone-eluting IUD. So an IUD that has hormones, that can cause acne for some people. Not for everybody, but for some individuals that may precipitate flares of hormonal acne. Other things that might be leading to your acne could be just stress. A lot of us are not getting enough sleep, and that can become a chronic problem that raises your cortisol levels, and those excess levels of circulating cortisol can lead to more acne. In some circumstances, individuals can have elevated levels of hormones that could indicate a problem inside the body. As a dermatologist who sees patients with hormonal acne, I find that that's really quite uncommon. If you're dealing with hormonal acne that's not responding to most of the typical treatments and you're seeing a doctor, then it might be time to do a hormone panel workup. However, most of the time in my experience, checking hormone levels in most adult women who have hormonal acne really just shows normal results. And the last thing that could precipitate hormonal acne might just be a bad skincare routine or no skincare routine. Perhaps you're using too much makeup and it's plugging up your pores, or you're using skincare products that are causing inflammation on the skin, therefore leading to more acne. So what are the treatments for hormonal acne? Starting back at the beginning, when we're talking about foods, obviously the healthier you are inside the body, usually the healthier you're going to be on the outside of the skin. So if you do have maybe a less than ideal diet, it might be time to make some changes. So what we know from the data is that skim milk can precipitate acne in some individuals, but whole milk or 2% doesn't necessarily do that. So you certainly could switch milk if you drink a lot of skim milk or go to a plant-based milk, and also just try to get away from the junk food because that can be bad for us both internally and on our skin. But if you eat pretty good and you have a good exercise routine and you're otherwise in good shape, then that's probably not the issue. If we're looking at birth control, perhaps you have one of the types of birth control that could precipitate acne, might be worth a conversation with your dermatologist or with your gynecologist to determine if a different type of birth control could be appropriate for you. There's a number of oral contraceptive pills that are FDA approved for the treatment of acne. Perhaps one of those would be appropriate for you, but that's really a conversation you have to have between you and your primary care physician, gynecologist, or dermatologist. Now let's talk about stress, sleep quality, all those other things that impact you every single day. Getting good sleep is critically important, and in a previous video I reviewed some of the devices that help me to get the best night's sleep. One of those was my Oura Ring, one of those was my Uller mattress, and another one was red light therapy. Now, you can spend a lot of money on these types of devices, and it's not necessary for everybody. Most of the time, just getting in a good sleep hygiene routine where you're going to bed at the same time, waking up at the same time, and then getting your routine going in the day, that's going to help a lot of people. Putting down screens an hour before bedtime so you're not stimulating your brain with that high energy blue light, high energy visible light, those types of things will help your natural circadian rhythm to turn on when it's supposed to, and then to wake you up when you're supposed to. As long as you have a good, consistent sleep schedule, you're not going to be spiking your cortisol every single morning in a stress response because you're underslept. And the world is going crazy. There's so many other stressors. So always make sure that you're taking time, whatever it is for you that helps you to recharge your battery. Make sure you're trying to include that in your daily, weekly, or monthly routine, depending on what your schedule allows. Sometimes you have to be a little bit selfish with your time, and that's okay. Being a better you is going to help you be better for the other people that depend on you. And lastly, let's talk about the skincare that can help with hormonal acne. From an over-the-counter perspective, there's a few things that I find particularly helpful. Overall, I generally recommend just a gentle cleanser for most individuals, but I find that people with hormonal acne might benefit a little bit more from a salicylic acid-based cleanser. I like salicylic acid as a wash-off product. I think it does a good job to help penetrate and clear out those oil glands. So they can help to remove sebaceous filament, and they can help to get rid of all that excess oil that may contribute to hormonal acne. If you prefer to use a gentle cleanser, which is what I do, a topical salicylic acid in a leave-on product can be a great option also. Up to 2% salicylic acid is available over the counter, and you can apply that as spot treatment right to those pimples as soon as you start to feel them popping up below the skin. An alternative spot treatment that's available at most all drugstores or grocery stores is going to be benzoyl peroxide. Benzoyl peroxide is one of the most common and readily available ingredients to treat acne. It can work on all types of acne, including hormonal acne. If you find that those don't work really well for you, you could try something called azelaic acid. There's a number of preparations of azelaic acid available over the counter, up to 10% in strength. Azelaic acid can help to kill some of the bacteria that causes acne, and it also has the benefit of helping to remove dark spots on the skin. One of the most tried and true ingredients to treat acne is retinol, and there's a lot of retinol available over the counter. So as you look for the ones to try, you don't have to jump into the most expensive to begin with. There's a lot of brands that I like, and I'm going to link some of them in the video description. Retinol can be irritating to the skin, so it's important to start out slow. Maybe use it only twice a week as you get going, and always moisturize afterwards. One other tip for using retinol is to use it on dry skin. So wash your face at night, totally dry it, make sure it's dry before you apply the retinol, and then it's safe to moisturize afterwards. Retinol doesn't work really well as a spot treatment. It's best for daily use as a preventative. So as you start out twice a week, then maybe you can work up to every other night, and then eventually to daily use, as long as it's not causing extra irritation on your skin. Now, what if you've exhausted all of those over-the-counter options and it's time to visit a dermatologist? Let's save you a little bit of money by knowing what kind of products you can ask for or what kind of questions you should ask when you're seeing the dermatologist. This may be a place where you talk about birth control to see if that's appropriate for you, depending on your age and other health factors. One of the more common oral medicines that dermatologists will prescribe for hormonal acne is a blood pressure pill called spironolactone. Spironolactone has some anti-androgen abilities, and so as it gets into your system, it can lower your blood pressure a little bit. It's not a great blood pressure pill, to be honest, by itself. Usually if we're treating somebody for blood pressure, it's the second, third, or fourth pill that we add on for really stubborn blood pressure. But it can be taken at low doses pretty safely for the majority of people in order to help block some of those hormone receptors in the skin. There are certain risks with spironolactone, so it's important to cover those with your dermatologist if you tend to have really low blood pressure to start with, or you have other electrolyte issues in your body. Those things can be important to monitor. In rare circumstances, I'll use something called metformin for my really stubborn hormonal acne patients. It can be an add-on to some of these others, but I won't get too far into that. It's something that we do a little bit more of a workup, and there's more counseling for the potential side effects, even though metformin is probably one of the most common drugs prescribed in the world because it's one of the first things to use for diabetes. What kind of topical products could you get from your dermatologist if you're getting prescriptions to help treat that hormonal acne? Well, first we could get a stronger retinol medication, or a retinol combined with a benzoyl peroxide, or a retinol combined with a benzoyl peroxide. These combination medicines can really help to simplify your skincare routine by getting on a retinol and another active ingredient all at the same time. We can also get higher strengths of azelaic acid, and for some people that's an appropriate thing. In really serious circumstances of hormonal acne, a dermatologist can also have a conversation with you about Accutane. Accutane is something we will discuss on other videos. We're not going to go into depth with it here, but there are times when I'll use it for my patients who have adult hormonal acne. And lastly, a dermatologist may be able to recommend certain cosmetic procedures like laser treatments or chemical peels that can really do a lot to help with hormonal acne. However, these are usually going to be out-of-pocket expenses and probably aren't the go-to for most people right off the bat. Now, like we talked about at the beginning of the video, acne was just one part of this. In the next video, we're going to cover what you can do to treat those stubborn wrinkles. If you found this information helpful for you, go ahead and hit that subscribe button, and I'll see you next when we talk about wrinkles.